Okay, here it is. We've all been told things, heard things, read things about fluoride, and some of them contradict each other, some of them are fearful. In this video, I'm going to unpack the story of fluoride, both how I was trained, what I heard, what I read, what I discovered, and share it with you to hopefully demystify the topic of fluoride. People have asked me for a long time to make a video about fluoride. Well, here it is. And the reason it's taken me a while to make this video is that it's a very big topic. It's got people who are totally against fluoride. There are people who are totally for fluoride. There's a lot of controversy, misunderstanding. People feel scared of fluoride. People think you should have fluoride. What is the truth around this incredible topic, fluoride? In this video, I want to share with you how it was when I first learned about fluoride. I was a dental student in England in the 1960s. And from there, how come I changed my opinions about fluoride in 1984? That was the big watershed moment for me. And then, how come I sort of stand middle ground now? I'm neither for nor against, in actual fact. I have a position. And that position is really not very comfortable. I have people on one side who don't want anything to do with me because I stand in the middle. And then I have people on the other side who don't understand why I'm standing against them when it comes to advocating for fluoride. You see, I'm right here in this uncomfortable middle ground. And people who've followed me and know what I talk about and have bought my books and have read my position and understand have usually come alongside me and are on board and have seen the benefits of being in this middle ground. And that's what I want to share with you today. But in order for you to understand why I'm here, I think we have to go back over this journey of how I got here. And before we begin, I want to let you know, I am not sponsored in any way by any company for the products that I recommend. None of them. I have recommended the same products to people to use now for well over 40 years. And I go to the grocery store and buy my own products the same as I recommend for you. I practice what I preach. I do what I do. I believe what I believe. And I want to share this long journey that I went on that starts back actually in the 1960s. And in this video, you will hear this journey, the story of all of these different things that happened to me. Then we'll talk more about the chemistry of fluoride, why you cannot really talk about fluoride without breaking it apart and looking at different aspects and the ways that different kinds of fluoride work and how they work. And then finally, I want to conclude with how you can put what we talk about today in perspective into your life, know when not to touch fluoride, know which fluoride you can touch if you want to, and where to use it when you want to, if you want to. So if you'll begin with me on this journey, let's take ourselves way back into the 1960s and put ourselves in England at that time. Now, I was at dental school and we were trained that fluoride was a wonderful thing that in America had just been put into the drinking water. And this is a story that began in the early 1900s in Colorado Springs. It was a dentist in America who had noticed certain teeth were harder and more resistant to cavities than other teeth that he'd ever seen before. His dental office was full of people with these really cavity-resistant teeth, but they had a problem. The teeth had little markings on them. What happened in America ended up with an exploration of why these teeth were so hard, and they discovered exactly how to balance the fluoride in the drinking water, taking it out because in that particular practice there was too much. That's why these kids had little markings in their teeth. So they took away the excess fluoride out of the water And yet in cities where there wasn't enough, they put it in. And that was the story of the first fluoridation of water in America. And it occurred in Grand Rapids, Michigan in 1945. And the studies were done fairly quickly. And there was quite a lot of outcry that people didn't believe that should be happening. There were equal number of dentists who were totally on board because there was an enormous amount of tooth decay in the country at that time. And in England, we had enormous problems with people's teeth. Tooth decay was outrageous in the 1960s. And when I was a dental student, I was fully aware of the terrible teeth of the people that we were treating at dental school. So we didn't have fluoride in the drinking water in England anywhere at the time. It hadn't been added into English water because we were only just a little bit of time out from those very first studies of 1945. 15 years in the world of science is not very long. And so instead of fluoridating the water, dentists were encouraged to order little bottles of sodium fluoride in these little bottles that we could give to our patients so that they could add it to their drinking water and consume it. And particularly it was recommended for children as well as for adults. And I didn't have children when I began in my career in dentistry, and I had my own practice quite soon after I began. And in this practice that was geared specifically to phobic patients, you see, you could also understand at that moment in history in England, women were not usually dentists. It was an unusual thing for somebody to walk into a dental office and find a woman. And a lot of men were really not sure they wanted to be treated by a woman. They didn't think we were strong enough or smart enough, I think was one of the problems. So they didn't want to get into that. And I had patients actually get out of my chair and decide they didn't want to be treated by me. But I found I worked out pretty well for a lot of the patients who were phobic or nervous. I think for some reason they felt more comfortable in the hands of, I hope, a compassionate dentist. And I really was aware of what it was like to be afraid of the dentist, to be scared of dentistry. I didn't like going to the dentist as a child. It had been a terrifying experience. So my office was very much geared for people who had phobias, who were terrified of dentistry. I saw a lot of children, I saw a lot of special needs patients, and I saw a lot of women. And these were mothers, sisters, grandmas. A lot of them were family members, one brought another, because they liked what they found. I would teach them things. I would teach them how to avoid the need for unnecessary dental treatments. And that is what I have done now for 50 years, longer than that, in fact. And part of this, I believed, was the use of fluoride. And what I would have my adult patients do was a special regimen where they rinsed with fluoride, this sodium fluoride drops, they would put it in water at night and rinse it around their mouths. And I saw unbelievable reaction. I saw an unbelievable change. We saw cavities actually could go away. Teeth would harden up. People's teeth would get whiter and shinier and more comfortable. It was an incredible experience, and I was fully engaged in this conversation surrounding fluoride. So you can imagine when I was pregnant and my first child was then born in 1977, to give her fluoride. It seemed the obvious thing to do. So in the baby bottles and her drinks throughout her early childhood, I would put 5 of these drops of fluoride provided by the British government into everything that she had to eat or drink. We were told the teeth would come through, they would be stronger, they would be harder, they would be shinier. Now, bear with me for 1 minute because it was an epiphany, even when I was preparing for this video, that if 1945 was the beginning of people trying this experiment, basically, of adding fluoride to drinking water, it was only 15 years since that very first water was fluoridated. That was hardly enough time to see the long-term effects of what happens to children who grow up in these communities where fluoride is added to water. Certainly in England, we had only been giving these drops for about 10 years, and that was hardly time for any of us to have seen anything except these remarkable changes that I had witnessed in adult teeth. When my children started to erupt, and I have to mention I had 3 children fairly rapidly, one after the other, so the children born in 1979 and 1980 also had fluoride given to them as they were growing up. The first adult teeth actually erupted, came into the mouth in 1984. In 1984, when my children were 7 years old, is when these first front teeth popped into the mouth. And as a mother, I'm excited. I'm going to see these new, whiter, shinier, healthier, stronger teeth come in. You can imagine my dismay, in fact, my absolute shock, to find that my oldest daughter's teeth were brown, chocolate-colored brown. And they were not smooth and shiny. They were crumpled and crinkled. And the problem was what? I didn't know. I didn't understand. It didn't seem right until I remembered the story of how fluoride had begun. I remembered that that story of adding fluoride to the water and adjusting the supply of the water to be exactly balanced began with too much fluoride. The Colorado dentist who had seen teeth that were very hard and resistant to cavities had actually first noticed something that was called the Colorado brown stain. I didn't understand. I didn't know what was going on. Something was wrong with my daughter's teeth. I started my research. And it just so happened at that moment in time, I had access to one of the best medical libraries in the country, the Rochester University in New York. The Minor Library was where I spent my days putting together this story of fluoride. It was before the internet. Today I could have done a Google search, but back then I pulled every book that I could from the library shelves, and I remember a table packed with books and making notes and trying to piece together this story. And I'm not going to go through the whole story of water fluoridation now. I've talked about that a little bit in a video I did about fluorosis, because these marks that were on my daughter's teeth were quite severe fluorosis. And this kind of fluorosis occurs and can only occur between the age of birth and 6 years old. There is no adult fluorosis. If you see brown marks on your teeth because you're using fluoride mouthwash, you probably need a better toothbrush, or you need to follow my gum brushing and tooth brushing exercises, because it's probably superficial plaque staining that you can get off in a few seconds. But this kind of problem, this is inbuilt. This is something that occurs because the cells that lay down tooth enamel in a baby's jaw, it begins at birth and it goes on until a child is 6 years old. The adult teeth, not the baby teeth, you will see no change in the baby teeth. They form in the mother's uterus when the baby is developing, and they're fine. But after birth, and actually at birth, that very moment from then on, the adult permanent teeth begin to form their enamel and then calcify around and underneath. And the enamel is secreted, or actually pushed out, by little cells that are called ameloblasts. And these ameloblasts are extremely sensitive to fluoride. And by giving my kids drinks with fluoride as babies, as 6 months old, as 1 year olds, as 2 year olds, as 3, all the way through until the age of 6 or 7, your children have these cells in their jaws that are incredibly delicate. They are so easily unbalanced, being exposed to fluoride, not in the mouth, but as fluoride travels around the body. Because when you're drinking fluoride, this travels around your body. And for an adult, what I was giving my children would have had no effect. But for little children under the age of 6, and I can't make this clear enough, you do not want small children to be drinking fluoride. I know that seems weird because you've been told how good it is for children's teeth. Some people grow up thinking they've got cavities because they didn't have fluoride. It's one of the big lies that gets talked about when people are discussing whether we should put fluoride into drinking water or not. And really, we have to look at that because we don't want little children to be drinking fluoride. We want adults to have some benefit, but we don't want to do it by giving fluoride to children. So let's get that point right out there right now. I discovered that I had basically done this to my oldest child's teeth, and there was nothing I could really do at that point about it. The next sister was born. She had almost the same kind of mottling, only a little bit less severe. Probably I was a bit busier and gave her less drops. And her teeth were covered with white spots and white clouds all over her teeth. And that is moderate fluorosis. And my son had less fluorosis, probably because I was a very busy mother and missed several days in a row, so he did not get as much. I have 5 children, so the end of that story was that I knew not to give fluoride to my younger children. So I made sure if I made baby bottles for them to drink or snacks or drinks that I used either water that was filtered out with no fluoride, or I actually used Evian water or bottled water that had no fluoride in it. And that's how I dealt with my younger children's teeth and used instead my preventive strategies once their adult teeth came in. So I want to make it clear that I am totally changed by this experience of finding I had damaged as a mother. When you have caused the damage to your child's teeth, as a dentist who is passionate about preventive oral health and the need for all of us to have beautiful, healthy, shiny, strong teeth, I was devastated that I had done that to my children. But I could have become very quickly a so-called anti-fluoridationist. And I didn't. And that's the part of the story that I think is important for everybody who is interested to know. Because why didn't I? And it was because I had already experienced over 10 years of dramatic changes in people's mouths when they rinsed and used this fluoride mouthwash that I had given these adults to use. I had to balance this whole thing. And I think that's where I sat with fluoride for a long time until I realized the big difference between drinking fluoride and why do we need to drink it? We don't. And topical, or putting on the top of teeth, adequate fluoride for the fluoride to strengthen the teeth. And there are lots of different kinds of fluoride, so you understand why this isn't a blanket statement, but why certain kinds and certain ways of applying fluoride can be incredibly helpful, and why I don't believe we should just discount fluoride completely. The other little part of this is to say that fluoride is naturally occurring. It's a substance in soil, in water supplies, just like it came down from Pikes Peak in Colorado. Every time the snow melt occurred, it used to be in the drinking water because part of Pikes Peak there in Colorado has a band of soil that has fluoride in it. That doesn't mean you can never drink water in Colorado. It just means naturally occurring fluoride exists. I live in Austin. Austin has about 0.3% naturally occurring fluoride in the drinking water here in Austin. It just is there, which is why I do not understand why we add more. There's no reason to, and there's no need to, and I believe that is where we're going wrong. And I would put out a cry to the public to try to understand, if I can help in any way, why this is not something we should do for everybody. Because the people who are most harmed are young children who are getting too much fluoride. Maybe they're drinking more water than has been calculated, or they are more sensitive, as we say, to this fluoride under the age of 6. So now I'd love you to settle in and let's talk a little bit about the chemistry behind fluoride. If you want to have an intelligent conversation with somebody, whether you're for fluoride or against it, you need to be saying words that make sense. See, I have people who say they're not going to listen to me because they see I support fluoride. And my first question to them, to try to engage a conversation even, would be to say, wait a minute, what kind of fluoride are we talking about? Because I don't give fluoride a blanket approval. There are many, many different kinds, and you need to understand what a fluoride compound is. And then, if you do talk to somebody or with somebody, or you want to engage in understanding more, you'll know how to do this. When it was first introduced, we didn't really know these things. We heard they were putting fluoride in the drinking water, and it was supposed to be sodium fluoride. The end of that story actually is that sodium fluoride is the most expensive kind of fluoride. It's the most stable, but most expensive that they could have added to the water supplies. And in most cases, in most water supplies, like Austin, it's a compound that is not sodium fluoride. It is a silico aluminum fluoridated compound of some kind. So it's not the pure form, it's different. And the argument is that when it's in water, it all breaks up. I'm not buying that argument, because the fluoride that I'm going to always recommend is sodium fluoride. And now I want to explain why. Fluoride is a very reactive compound. It isn't even fluoride, it's fluorine. And fluorine is the individual element, as it were. Fluorine is actually a gas, similar to chlorine. You may have heard of chlorine gas. It's actually poisonous, and so is fluorine gas. And if you don't believe that fluorine and chlorine are very similar, what you need to look at is a periodic table, this chemistry table. Do you remember from chemistry? With all these little squares and colors. And these halogens are put together, and chlorine and fluorine are next door to each other. That means that these elements are similar. They're like sisters. Actually, they're almost like twins, chlorine and fluorine. And they behave in a very similar way. Their pattern of behavior mirrors one another. Instead of talking about fluorine for a minute, being similar to chlorine gas, let's talk about chlorine, because this is a product, or the compounds of chlorine are things we use often in our house. And I think you'll understand with a little less emotion if I talk about chlorine. So we have chlorine gas, and we don't want to inhale that because it is poisonous and will kill us. But we, every day, probably need to eat a little bit of sodium chloride. That is when chlorine connects with sodium chloride. Lots of people out there already know where I'm going with this. That is table salt. That is Himalayan sea salt. That is Celtic salt. It is the chemistry name for what we put on our broccoli and our food, and we spice things up and we season it. And we know that a little bit of salt every day actually is really good, especially if you live in Texas or places in the desert where you're perspiring and sweating and you need some salt. Sodium chloride. Now, something that sounds kind of similar, sodium hypochlorite, is bleach. We probably don't want to be putting that on our food. So it's really important not to just say, I hate chloride. You can't. We want the sodium chloride, but we don't want some of these other poisonous gases or perhaps bleach in particular situations. That is the sister element. Now let's talk about fluoride. See, fluoride can also form a stable salt, and that is the one that I would recommend, sodium fluoride. But the problem with that is it's the expensive one. So if you're out there buying toothpaste, the toothpaste that I recommend is sodium fluoride. At the one that you may find, because it's usually at eye level because it's cheaper, is Stannous fluoride. Oh my goodness, you really have to be clever to see the difference. They both begin with an S. The one you want is, can you remember? Sodium. If you can't remember which one you need, ask your phone, what is the chemical name for table salt? Because the salt of fluoride that I want you to have is sodium fluoride. The one I don't want you to buy is Stannous fluoride. That is made from tin. It is a metal-based fluoride. It is cheaper. And right now there is enormous marketing to sell that to dentists and to teach dental students that that is a better way to go. Stannous fluoride makes little compounds that block up the enamel in your teeth. So it's being marketed as a great way to stop sensitivity. I don't want my enamel blocked up with a tin-based compound that has caused some sort of putty to form on the edge of my enamel. I don't want that. So Stannous fluoride is the cheaper, but now going to be heavily marketed. And there are Crest toothpastes that contain sodium fluoride. And there are the very similar looking Crest toothpastes that contain Stannous fluoride. So be warned. And if you live in a country where you're looking for a toothpaste, the kind of toothpaste that I would recommend to apply to the outside of your teeth as an adult over the age of 6 or 7 would be sodium fluoride. Okay, we got that straight. The next thing, not only are there these different compounds of fluoride, but there are different strengths. You see, the difference between my recommendations and sometimes recommendations patients have been given by the dentist has prescribed some kind of fluoride gel. Strong fluoride gels sound like they might be better. I would not recommend strong fluoride because you're going down the road that could potentially change the bacteria composition of your mouth. Back again to the bad guy, the Stannous, the tin-based fluoride. That has a similar effect. It can be toxic to bacteria. Guess how they market that? It gets rid of plaque for you. Plaque and probably the bacteria that you don't want to get rid of. So is it true or is it false that fluoride upsets bacteria in the mouth? Well, it all depends. It depends what kind of fluoride you're using. It depends how strong it is. And it depends how you're using it. So we cannot make blanket statements. We cannot say it's good or bad. You have to know what you're talking about. And I would only recommend sodium fluoride in very, very dilute concentrations. Concentrations that most dentists do not think are adequate, at least the dentists who believe in fluoride. They would rather prescribe something like Preventive, some of the stronger gels. I don't go down that road. 2, 4, 3% is what you need to look at on a toothpaste. 0.05% is what you want to look for in a rinse that you use. And I recommend brushing your teeth with fluoride. I also recommend rinsing your teeth with fluoride. And those are the concentrations, and you can go to my website and look at the products I recommend. But they're very specific and they're very dilute. And the reason they're dilute is because it's not working in any kind of peculiar way. It's working simply to coat the outside of your teeth in the kind of way that if it was a skin product, it would be called a moisturizer. It would create a kind of outside film that helps your teeth to stay balanced. And in this case, the fluoride in your mouth, when you rinse with this very dilute sodium fluoride, actually acts as a catalyst. Another chemical term, which really means it's helping to pull minerals that are floating around in your saliva into the teeth. Now, in the old days, when I began learning about fluoride in chemistry, we thought that it created some special kind of big fluoride compound where it was all kind of jumbled together. That isn't now how we believe fluoride works. It works almost like a magnet. If you want to think of it as anything, it's like an ionic charge that's telling the minerals from your liquids in your mouth to go into your teeth, which is where they were going anyway, but to hurry along, please, and get in there, to do it a little faster and a little more completely. And that's what good dilute fluoride mouth rinsing does. It simply aids your mouth to heal itself more quickly. Back in the day, when I was first a dentist, we would use a gel. If any of you are kind of my age, you may have sat in the dental chair as a child and had these horrible trays full of this really gloopy stuff stuck into your mouth while you choked and thought you were going to vomit. That gel, acidulated sodium fluoride, it was sodium fluoride, but it was acidulated, it was acidified. You can probably remember how acidified it was almost 10,000 times stronger than the rinse that I currently recommend. So that's why I don't recommend fluoride varnishes, fluoride gels, fluoride things that are incredibly strong. And you don't need them if you can daily, twice a day ideally, certainly last thing before sleep at night, rinse your mouth with this dilute sodium fluoride at 0.05. Now, I just mentioned that acidifying it was what we did in dental offices back in the day. The reason that it was acidified and made so strong was because we knew that fluoride in an acidic environment is more powerful. And they were trying to give kids this sort of like superdose of fluoride. What I use in my complete mouth care system that I recommend is the acidity of Listerine used right before the dilute sodium fluoride mouthwash to actually enhance, to magnify these mineralizing powers of fluoride. Now, Listerine has other benefits, and this is not the video for me to talk about that. And Listerine has problems too. And we won't talk about the good and the bad and the ugly of Listerine here, because the way that I recommend it is purely for the benefits. And if you follow my system, that's what you get from the Listerine. We protect you from any of the negative effects and simply give you the benefits. And I thought that it might be interesting in this video simply to point out that the reason we do the Listerine right before the dilute sodium fluoride rinse is to multiply the benefits of this 0.05 sodium fluoride mouth rinse many, many times. The company that makes the fluoride mouth rinse act that I recommend has a product where they mix an acidity into the rinse. They claim on the ads that it makes it 7 times more effective. I believe, again, going back to my analogy with skincare, that the acidity is kind of like a toner after which you put on the moisturizer. What this company has done is mix the two together. What would happen if you mixed your toner with your moisturizer? You get a little of the benefit of the toner, but you dilute the benefit of the moisturizer. So maybe you do enhance the effect, but you also negate it somewhat. Based on that philosophy, I believe that by doing the acidifying before you use the final fluoride rinse, we probably multiply and maximize the benefit. I'm guessing, but my guess is about 20 times more than if you simply use the fluoride toothpaste or rinse alone. So this is why I have a system, and this is how the chemistry of this system works. I put together products that work in synergy, in chemical synergy with one another to maximize the outcome. How come I'm so excited about the chemistry of fluoride? Well, I think it's important to understand, and I also had a background in chemistry that was required of me because I was a woman. I had to get it at a very high, the highest level possible. In America, that would be a 4.0 before they would even allow me to apply to dental school. I had to have physics, chemistry, and biology. One-time exam at that really high level, and I had no idea what that level was. So believe me, I used to go to bed at night listening to tapes with my brown recording tape recorder. I would listen to the chemistry and all the equivalency tables and everything. That was what I was immersed in for 2 years before I went to dental school. So I've always had an interest in chemistry and the biology of mouth health, and I have brought that along with me, studying it, not because I was trained in this at dental school. That's why you can say, why doesn't my dentist know this? I was taught how to study chemistry, but my investigations, they're pretty common sense, and they're really joining the dots of a picture together. But I did that because I was fascinated, and I had, as I've just explained earlier in this video, I had a reason to understand fluoride in particular. The topic of fluoride really separates the dental profession. I'm sure you've noticed that there are regular dentists who work in regular dental offices, and most of them will want to put fluoride varnish on your kids' teeth, or they will give you toothpaste as you go home that has fluoride in it. They are fully immersed. They're not looking at whether it's stannous or sodium. They're giving away whatever the companies are giving to them. They don't mind. They don't probably know that there are all these differences. As I mentioned, this is a self-journey that I took myself on, and I've been on it now for over 40 years since discovering what had happened to my children. I became fiercely interested in how do you marry the benefits without the harms. And I don't think unless I had traveled this journey, I would have been any different from any other dentist. I don't know if I would have been in the you've got to use fluoride camp, or perhaps the biologic world where people are more alternative, who believe in health foods and the importance of the gut biome. Because honestly, that's where I fit myself, always have done. At the age of 14, I was a health food nut. I used to shop in little health food stores in back alleys. They were little dark places where you'd go and get your oats and millets and make your own vitamins. And this was me. I was a teenager, completely immersed in the benefits of what you would get from eating good foods, the different foods with fiber and the nutrients that you could get by mixing spices. And that was me. I have been a health food nut ever since. That was my philosophy of life, is that nature provides us with these incredible tools. I could take it one step further to say nature actually provides us with these tools that can help us to heal ourselves. And that is, if we do that every day in advance of damage, that is what I call prevention. You prevent damage by healing yourself before the damage begins. And that is my philosophy about dental care. Anyone who has watched my videos will know that I introduce myself often as someone who helps you avoid unnecessary dental treatments. I want you to have beautiful, healthy, shiny, natural teeth so that you don't have a need even to go for cleaning. Ideally, that the plaque disappears, your teeth are smooth and hard and shiny, you don't need anything done to them. To me, that is the dream. That is my goal as a dentist, is for you to experience the dream mouth. I have achieved it. It took time, it took learning, it took experimenting on my poor, unfortunate children. But my youngest child is the beneficiary of the dream. She has never had a dental cleaning, with the exception of the time she drove herself to the dentist with a new car and didn't have the nerve to tell him not to do a cleaning. But apart from that one incident, she has never had a dental cleaning. Her teeth are beautiful. She was in the Smile poster for Whole Foods. Her teeth are so great. That is the beneficiary. She is the beneficiary of the strategies that I recommend. But I want you to know that I would put myself in the category with biologic dentists from the point of view of wanting this natural approach. The argument, in a way, that I have with biologic dentistry is that most biologic dentists would be averse. I have patients all the time telling me, oh, I use your system, but I've never told my dentist because he doesn't believe in fluoride. And you see, I hear over and over again these stories of people. First of all, they go to take their silver amalgams out, and we have another video on that, but they change it to have a white filling. We have a video about that too. But the white fillings act as plaque magnets. And so very soon thereafter, about 10 years later, those fillings need replacement. And then 10 or so years after that, often these teeth die, then they crack, then they need root canals, then perhaps the root canal fails, then perhaps they need an implant, or even worse, an extraction perhaps, or which is worse. I don't know, you don't want that. As I said, my goal for you is nothing. No treatment, perfect teeth, strong, healthy, because then your body will be healthy. Your gums will be healthy. Every filling a dentist puts in puts your gums at risk. Every filling a dentist put in has the risk of killing your tooth. This is the fact. And every cavity is preventable and reversible if you begin soon enough. Do I believe in biologic dentistry? Yes-ish. But not all the treatment that goes on there all the time. Why do they not believe in fluoride? Because they believe it's a toxin, a neurotoxin, or it's dangerous for you. Well, we've explained that drinking it is very different from applying it topically and spitting it out. You can argue, what about absorbing it through the skin? Because we know that you can easily absorb things through the mouth. Well, it all depends on the molecule size. And years ago, there was an acupuncturist here in Austin, actually long before I lived in Austin, and she was really interested in oral health and my strategies. And she was also, as a complete holistic healer, also open-minded enough to listen to me. We went out and discussed fluoride in great depth, and she understood. I told her what I've told you today. It was probably an hour seminar for her too. But she got the message. But she was worried. She was worried about this absorption, particularly because her husband was a doctor who treated Hashimoto's patients. That's when your thyroid is problematic, and where you should not have excess fluoride in your body because you have a thyroid upset. She was concerned, does the fluoride get into your bloodstream when you rinse with it? Does it get into your bloodstream if you brush your teeth with it? And so they did testing, they did blood tests, they looked at that. And were satisfied that in the way I recommend, with the dilution that I recommend, in the strategy that I recommend, there was no problem. They supported the really sick patients with a little iodine support. You need to be aware, fluoride is in foods and drinks. I've told the story before, but it's worth telling again, that I was in the sauna one day listening to two girls talking, and they were talking about their thyroid problems. And I couldn't bear it anymore. I had to say, excuse me, you do know that there's fluoride in iced tea. Tea has a lot of fluoride in it. It's the leaves of the tea plant that actually concentrate fluoride within itself. So if you brew a pot of tea, you have a pot of quite strong fluoride, many times stronger than the mouth rinse that I recommend. And these girls had no idea. I recommend maybe if you have a thyroid problem, you should keep your ingestion of iced tea to about 10 ounces a day. She was like, oh my goodness, I make myself pots, big jugs of iced tea to drink. That would not be a good idea if you have a thyroid problem. So let's be realistic about where fluoride exists and realize that drinking it is very different from topical. The amount you use, or the strength, the concentrations that I'm talking about are very, very dilute. You could drink it. You don't want to drink green liquid like I suggest, but you could, because it isn't that strong. And the amount I recommend would be half the amount that they tell you on the bottle to use. And were you to drink it, nothing would happen. It's less than in the iced tea. So let's be realistic about what we're doing. Let's understand that fluoride, or if you have kidney problems, you don't want to be drinking it. Let's learn which foods. It's in potatoes, it's in certain other foods. Let's get ourselves well acquainted with where fluoride at high concentrations is. So if you have a kidney problem or a thyroid problem, you can be very careful about how much you ingest. I'm with you. Let's get those facts. Let's let the Fluoride Network people put those facts out there for everybody, and let's look at them online. That's the best source ever. But let's not be so terrified of fluoride that you won't brush it on your teeth or rinse with it, but you would prefer to have fillings deteriorate around the edges of them, which is what happens when you have a white filling. It isn't the filling that deteriorates, it's the fact that it attracts plaque. Plaque erodes the enamel around the edge of the filling or edge of a sealant, and this erosion allows a porosity and openings to occur, and the bacteria of your mouth can get in there and form cavities. That's why your teeth need more filling and more fillings and new fillings and forever treatments and crowns, and that's why your teeth break, because they get porous. And women in particular, and this is one of my pet peeves, men do not usually suffer the same way young women suffer from acidic saliva. If your saliva, the liquid in your mouth, is acidic, it makes your teeth porous. If your teeth are porous, they will be open to decay, to fracture, to breaking, to all the damage and disease that occurs. If you rinse with fluoride at this dilute concentration that I've talked about, it works particularly well in acidic environments. We talked about that too. You, with your acidic saliva, are going to benefit so much that you are not going to have all these damaging things happen to your teeth. Before you go and have a filling, before you start down this journey, if you're just told that you have a small cavity, use the strategies that I recommend. Use them for 3 to 6 months, and the chances are you will make that cavity go away. That's how incredible this can be. The other incredible thing that I recommend is to use it in harmony with xylitol. We talked about how acidity can make fluoride more useful. Well, xylitol and fluoride are also kind of not sister elements, but they're sister companions. We found in studies years ago that by combining the use of regular small amounts of xylitol during the day with some dilute fluoride rinsing, you get not just the benefits of the fluoride rinsing plus the benefits of the xylitol, but they work in some synergistic way that boosts the outcome of the two to some level they wouldn't either one achieve by themselves. So it is called synergy. There is something going on between the use of xylitol and dilute fluoride rinsing that is particularly spectacular. So on that note, I'm not downplaying either side of dentistry. I understand why there are these two camps. I hope perhaps we can come together, that the new generation of dentists out there, and probably the forward-thinking, open-minded, good dentists in both camps, might spend time and learn some things they didn't know before about fluoride, or maybe they didn't have time to think about it. I've had a lot of time and a lot of occasion to think about fluoride. And that's really how I've taken these steps and ended up where I stand today. And if your dentist becomes interested, maybe it's a biologic dentist who has closed the door on fluoride, but because you are using my strategies and they are taking notice that things are improving, perhaps we can talk, or you can bring them a book, or give them a link to this video. And we can bring more people together, because the goal is that you will not end up with broken, decayed, pain and suffering from dental disease and damage that's completely preventable. So I want to wrap this up, and I appreciate your interest in this topic, but I want to make sure you understand that I am recommending topical use of sodium fluoride. That is a very specific compound of fluoride. And that this is all about the correct use of this correct product, a dilute sodium fluoride product used in the correct way, which would be the topical application of the product and not the ingestion of the product. If you'd like to learn more and learn more about the other products that I recommend, please go to drellie.com. That's my website, where you'll get a free downloadable booklet. There are links to all the products that I actually recommend, so you can look at them and go buy them by yourself, or you can go through Amazon, or you can get a kit to start out with, so you have everything exactly right. I also have a video boot camp where I interact with the students there as much as I possibly can to answer questions and put people on their journey to oral health.